porte voix.
Thank you, Mr. Speaker, and I'm very grateful to have this opportunity to contribute to this debate. And it is with great relief that we are now having a debate where we have passed the stage where, as the last government, we believed are pouring more money, improved outcomes, and we are now debating reform, and it is the scale of that reform that we should welcome so that we can head towards what patients want, improved outcomes. Whatever the good intentions of the previous government, there's no question that, unfortunately, their measures led to reduced productivity and, indeed, a massive increase in the growth of bureaucracy, a distortion of clinical priorities, which meant that those outcomes we seek, patients were not satisfied. But I have been more concerned. About the health outcomes. I've been more concerned about the fact that patients are becoming remote from the thing that matters to them most, and that is what the NHS is about. Who do patients trust? Do they trust a remote PCT, or do they trust their local doctor? There really is no contest, and I welcome these reforms because they will give the commissioning powers to the GPs and bring their patients closer to decisions about their future. And I do not recognise the picture painted by members opposite, saying that GPs do not welcome these proposals. Already over half the country is working under the Pathfinder shadow consortiums, and indeed in Enfield we are already rushing to sign up and have agreed our consortium, which I warmly welcome. They are keen to seize the opportunity. But let's turn to local accountability, because local accountability goes hand in hand with local commissioning-based services. Now, in the past, it has proved impossible to have genuine local accountability, as the NHS process all led directly, ultimately, to Whitehall and the Secretary of State. And I agree with the Nuffield Trust that widening involvement of independent providers, the use of social enterprises, community services, increase in foundation trusts, mean that local accountability mechanisms should indeed be robust. And some members earlier, and Croydon Central, I believe the member is sadly not in his place, and the member for West Lanarkshire, seemed concerned that they were not, and I would refer them for a start to Clause 170 on the independent advocacy services, Clause 175 that emphasises the scrutiny role of the local health authorities, not to mention the local representation of councillors and the Commission. Well, the Honourable Lady says from seat 1, but I can assure you I will not take lectures from the previous government that had no consultation as they tried to reconfigure our services in Enfield against the wishes of the public. And it is with that which what I will turn to. It makes no sense, as we were being asked, that the people who want to hold the healthcare community to account for their local services have to go to an intransigent bureaucracy and ultimately up to a Secretary of State removed from where the local decision-making is taken. As I said, in my constituency, we are reaching a critical stage now in the future configuration of our acute hospital services. The decision prompted by the previous government to downgrade and rip out our vital A&E and axe the consultant-led maternity services, which see 3,000 births a year, is being relentlessly pursued by those same bureaucrats and officials from the health services, despite the fact that that decision will cost lives. Now, in ignoring the wishes of thousands who took to the streets and the view of the majority of Enfield GPs, those same PCT officials are effectively trying to bully the residents into accepting these changes without the consent or consultation of the people, even at this late hour. No such arrogance would be evident had this bill been in place. Local people would be engaged in a genuine process of change, because such a proposal would have to be agreed by the local Health and Wellbeing Board. As my right honourable friend, the Secretary of State, said yesterday morning, with regard to possible future changes, any such changes would have to be agreed in the Health and Wellbeing Board of the local authority, which is publicly open and publicly accountable. Gone is the Whitehall knows best attitude to be replaced with local accountability, local engagement and local decision-making. Had this bill been in place as law, I do not believe we would have reached the 11th hour for this critical decision in Enfield, and that the 4 tests that the Secretary of State rightly requires would have been kicked into touch long before through genuine local accountability. The local authority, local GPs, and above all, local residents have spoken with one voice. And I am grateful. We have a Secretary of State who believes in local accountability and decision-making. In future, that voice that was ignored by the party opposite will be enshrined in the laws set out in this bill. For years we have suffered the lack of local accountability in the health service. I will give way.
Had this bill been law 10 years ago, it is my belief that Crawley Hospital would not have lost accident and emergency and maternity services. And it seems that you are agreeing with that in terms of your orders.
The honourable gentleman is being very generous. Can I just remind you the front bench wind-ups begin at 9:39. Mr. Nick-Dubois.
Thank you, Mr. Speaker. For years we've suffered the lack of local accountability in the health service. This bill delivers that accountability. For the health service, this bill is evolutionary, building on the successes and correcting the failures of the past, leading to improved outcomes. And for local people, it is a revolutionary bill, decentralising power to local people.
Twig.